In this video, we'll guide you through the next exercise, engaging a full arch lower Smartwire on the benchtop training Typodont. As mentioned in the last video, make sure to position the training Typodont as if you are working in the mouth seated at the 12 o'clock position. The upper arch should be closest to you, and the lower arch should be positioned further away. Before beginning this exercise, please pause this video if needed and retrieve an engager, lingual Weingart, the training Typodont, and the lower Smartwire, which is stored in the case located at the back of the Typodont. You may need to use the Weingart plier to pull the case out of the back of the Typodont. Before we begin engaging the lower Smartwire, here is a hand position recommendation for the lingual Weingart. When transitioning from the upper arch to the lower arch, you may find it more comfortable to rotate the Weingart in your hand so that the tips continue to point toward the teeth. This often makes it easier to grasp the neck of the locket. Another difference when working on a patient compared to the benchtop model segments is that when working on the lower arch, it is important to use your non-dominant hand to support and brace the patient's jaw. This counteracts the engagement force, stabilizes the lower jaw, and allows you to apply sufficient force to engage the lockets without causing discomfort for the patient. Now let's begin the exercise of engaging the larger 017 Smartwire. For a right-handed operator, use the Weingart plier to lightly grasp the neck of the lower left first premolar locket and place it in the bracket. Use your left hand to hold the locket in place while switching to the engager to complete engagement. For a left-handed operator, begin with the lower right 4 instead. Proceed with engaging all the brackets using the same engagement technique discussed in earlier videos. Seat the locket with the Weingart. Switch to the engager. Position the engager with proper angulation. Push on the bend of the engager with your non-dominant hand. Switch back to the Weingart and repeat the process until all lockets are engaged. This exercise simulates engaging a lower refinement Smartwire on a patient whose teeth are already well aligned and require only minor detailing. In situations where most of the alignment is complete, multiple anterior teeth lockets can often be seated with the Weingart plier before switching to the engager, like shown here. Once the lockets are seated, use the engager to center each neck between the occlusal tabs and apply force with your non-dominant hand to complete the engagement process. When working on the lower right 3 to 7, a right-handed operator may find it more comfortable to move to the 8 o'clock position, like shown on the right. Since the benchtop setup may limit your ability to move to an 8 o'clock position, rotate the Typodont by 90 degrees to simulate an 8 o'clock position if needed. You may also find it helpful to rotate the Weingart in your hand again so that the tips point toward the teeth, making it easier to grasp and seat the lockets. Proceed with engaging lower right 3 to 7 using the same technique as discussed in previous videos. In this chair position, you may not be able to support the patient's jaw with your non-dominant hand. If needed, ask the patient to brace their jaw and hold it steady while you engage the Smartwire. For left-handed operators, the opposite approach applies, working on lower left 3 to 7 at the 4 o'clock position. After all the lockets have been engaged, finish the engagement process by double-checking that all lockets are fully seated by applying labial pressure with the engager. This completes this exercise on engaging the full arch lower Smartwire on the training Typodont. In the next video, we'll guide you through disengaging the Smartwires on the training Typodont.